on Ms. Wethington's health status today. Makenzie was transferred to BIR Dallas last Friday from the University of Oklahoma Medical Center, and we'd like to acknowledge the great work of the physicians and staff there to bring Ms. Wethington to us. It's amazing that we're sitting here having a conversation about a young lady that fell from a tremendous height and is actually still alive. So we are very glad she's here with us, very glad that we feel that she's in the right place for rehabilitation. Just a little bit about BIR Dallas. We have been in the market for almost 40 years. We treat a variety of illnesses and conditions specifically focused on traumatic injuries, spinal cord injuries, brain injuries, stroke, and other orthopedic trauma. When you look at across the Metroplex, what makes BIR unique is that we sit across from a level 1 trauma center, Baylor University Medical Center, where we have almost 500 physicians on our staff that can come over and see patients, consult on patients, specialists that you would not normally see in a community rehab center. So we are very pleased to have her here. We believe, again, she's in the right hands. Of the physicians, and I'm going to introduce Dr. Seema Sikka. And Dr. Sikka is a fellowship-trained spinal cord injury physician in physical medicine. And just a little bit more about rehab. What is unique from an acute care hospital and a rehab hospital is that, one, a patient has to tolerate 3 hours of therapy a day. In addition, there's a requirement that they be seen by a physician, have access to a physical medicine physician 24/7, and also nursing care on a 24/7 basis as well. So Dr. Sikka, I'm going to turn this over to you, let you give a little update on Makenzie's condition, and then we'll go from there.
All right, thank you. So yes, again, my name's Dr. Seema Sikka, and so I have the pleasure of meeting Makenzie and her family, and although she just got here, so we're still kind of in our evaluation phase as far as how she's doing after now that her acute injuries have been treated, and so she is doing well. She's had multiple traumas, but actually has been staying in good spirits, and I think that's a lot due to the great support of her family and her friends who have been here for her, but she is now just kind of completing her rehab evaluations and starting to work initially on just getting up out of bed and working on her endurance and ability to transfer in and out of bed, and to do things like just be able to brush her teeth or eat or be able to get dressed, really starting at those things she needs to do when she goes home. And then actually today, I didn't get to see, but I heard that she was actually walking with assistance, with someone helping her in a device. And she has some weight-bearing precautions because of her fractures, so that kind of makes it a little more difficult. But she's actually doing very well, despite all of that, and tolerating her pain and working through it. And is already actually walking with help, which is great. So it's still hard to tell kind of how long that she'll need to be here before she can get home safely, but right now we're probably looking at a few weeks, but we're just getting that information now. And the goal here again is to get that initial intense rehab, but of course it won't stop here. She'll continue therapy when she goes home, and her family's already been here to help her and will continue to. So it's still, like I said, hard to say right now because it's still early on in our evaluation of her, but she's already doing very well, and from what we are seeing now, we expect and hope for a full recovery. And it's not been just me, it's a team effort. So here at BIR, we work in an interdisciplinary team. So she has a team of people working with her that include the physical therapist, the occupational therapist, speech therapist, neuropsychology, nutrition, respiratory, and the physician. So it's a whole team, and of course she's a major part of that, as well as her family. So she's doing well.
Very this time, we're going to let Ms. Holly Wethington and Mr. Joe Wethington make some comments, and then we'll open it up for questions.
First of all, I would like to thank everybody for their prayers and their support for Makenzie. She is doing fabulous. She did walk about 80 feet today, and she's doing it at a really remarkable pace. So she is doing really well. Her spirit is high, and she is ready and eager to get well. Y'all have any questions?
Can she speak?
Yes.
Very well.
Can you tell us what she remembers of it and what she thinks of all this now?
Didn't spoke of it yet.
Not at all. You didn't ask?
I asked before if she was agitated about it. So, but she'll get better. She'll be ready to go there too. At the rate that she's healing, now, I think even mentally she'll be ready to talk about it another day or two. So I mean, she was already ready to allow pictures, today. So I mean, that's another step, for her.
So she understands what's happened to her then?
Yes.
Oh, yes. She
She was-
remembers jumping out of the plane. She did tell me that. But she doesn't remember much after that, or she doesn't want to talk about it yet. She might need, some time, therapy, who knows what, but right now she's not ready.
On that note then, Doctor, would you be able to tell us, given her injuries, how would you suppose she landed? She remembers it, so she probably didn't land on her head. What do you think happened to her?
Yeah, it's really hard for me to say because I wasn't there and I didn't assess her initially with her acute injury. So I'm just seeing her now, and I'm not really. It's not really my area to understand the physics and the injury itself. And I've just seen like a wide number of cases. So I've seen a lot out there, and it's not that I'm always able to explain it. So right now I'm just focused on her recovery and the rehab part of it. So it's really hard for me to speak to the actual trauma and mechanism of it.
Joe, you were there. What did you see?
Well, I didn't get to see her land because she landed over on the other side of a berm.
What did you see from the point you saw there was a
I saw
problem?
her swinging and then spinning. Okay, she swung out and then she spun. But when she landed, she must have landed maybe on her left side. She has the left shoulder fractured. She has her left ribs are fractured. So I mean, the injuries are pretty much on the left side, somewhat.
Talk about what your reaction was when you were watching all of this.
Well, I didn't know that it was her until I got to her on the ground. So, but I knew that it was either the guy in front of her, which I pretty much figured wasn't going, or it was her. But I was sure hoping that he went. When I seen that, I was hoping that he went. And God forbid that happened to anyone. I don't wish that on anyone at all. But I'm sure it won't happen to my baby. I'd be standing there watching him. I just kept saying, please don't be Makenzie. Please don't be Makenzie. Please, God, don't be Makenzie.
Mr.
I
Wethington,
got over it was her.
is there any chance that Makenzie may have blacked out while falling, and that could have favorably?
Absolutely, the speed that she was turning.
She did tell me that she blacked out.
So her parachute partially opened,
Yes, it did.
and that might have helped break her fall somewhat.
Yes.
Okay, hold on for a minute.
Can we hold on 1 second? We're getting real bad audio. We just need to stick this up here. I'm sorry.
Yeah, it's horrible.
Where do y'all want it? You want to pass it, have them pass it down?
I don't. Yeah, and it could just be in front of me. Yeah, that's what I
Let's do this, because y'all are going to do most of the talking from now on. Is everybody else good?
I have no
You
idea.
guys want more?
Craig. Craig.
Just as close as you can.
They're very
There is a bug. You unplug me. CJ, can you unplug me?
One more.
We appreciate you
CJ.
guys being patient with us.
CJ, can you unplug me, please?
So,
One more.
were you already on the ground?
Yes, I was.
So you were watching
I was the
it.
first one out.
Was there a point in the
Was there a point in the fall where, like when the parachute initially opened, did she slow a little bit, or could you tell? I mean,
Once she went to a spin, it was just pretty much the same speed somewhat the whole way. And as the physician said, the speed was like being hit by a car, standing there and being hit by a car doing 55, 60 miles an hour.
so once there was a malfunction, then she started, it was like she was spinning?
Yeah.
And then the chute collapsed about 50 feet toward the ground?
No,
Didn't collapse at all?
I don't remember seeing that.
But it was only halfway open the whole way,
Yeah.
right?
Yeah, I don't know about the collapse. Where did that come in at?
FAA.
What, they said that's what's supposed to happen?
No. No. Here's you tell me if this is in sync with what you saw. One of the guide wires went over one part of the chute, collapsing that part. Because that part, it collapsed, it started spinning, and the more it spun, the more tangled it got. And then about 50 feet above the ground, it just totally gave way.
Okay, I don't know.
You don't know? You didn't see that?
Didn't see that. I don't know. It could have happened, and I'm not saying I just didn't see it. It might have been the time that I was I tried to run over there, and my shoe was still hooked to me, so I had to unhook drop my stuff, and so I could run over there. Might have been the time that I was doing that, but I didn't see that.
Have you? Is this your first time, or have you been up before? It's your first time too. Would you consider the training you had adequate?
No.
Tell me why.
I don't know. Well, because we weren't trained or schooled or what have you in any way for the problem that she had. Okay. We went over a line twist, okay, or a tear in the parachute, and that was it. Okay. And she had, from what I understand, I don't know because I haven't seen pictures or anything, but a couple of the experienced skydivers that go there all the time, or two skydivers, wherever they skydive at, had looked at the chute while I was on the ground and said she had a toggle fire. Okay, toggle fire or toggle burn, I don't know which is the correct metaphor for it, but which means one of the risers didn't come out of the sleeve. So I'm not sure. And he said that it was due to the equipment, not the operator. That's just what I don't know. So anybody travels.
Holly,
Yes.
what do you make of all this, both what he's talking about and where we are here? What do you make of this?
My concern is not about what happened that day, it's the fact that she is still alive today, and there's a reason for it. And my daughter is still here, and I get to see her every day. And as far as the parachute opening or not opening, it's my last concern. I don't care if she ever remembers. And I'm just glad she's here and she's walking. She's alive. She still has her sense of humor, and she's still my beautiful daughter.
I mean, talk about just, it's hard to fathom someone taking a fall of that extent and being as awake as she is. You know,
Yes.
just talk about your reaction to that. And
Oh, I consider myself blessed, and the first day she actually opened her eyes after she was unsedated, and she looked at me. I mean, that was terrifying in its own self, because she was very scared. She was still intubated at the time, and she was, as soon as she got calmed down, a couple hours later, she was already writing messages on a dry erase board at OU Medical Center. You know, what happened, where am I? You know, I mean, right then I knew that she was going to be all right. As far as, you know, a brain injury goes, I was just happy to see that.
What day was
It's
that?
a lot to take in.
What day was that?
She's healing at an amazing
That was on
rate.
Monday.
Monday.
You know, like she has some type of superpower or something, you know. Everything's just healing. She didn't
Yes.
expect, like the doctor said at OU, they didn't expect her to even come out of that at all. And now she's walking all the way across the room.
It's pretty clear this was her dream. I think that's been talked about. Can both of you speak to that and how that weighs into the type of team she is?
Well, I can tell you that yesterday, I asked her, well, aren't roller coasters enough for you? And she said they're boring. She is very, she wants to do anything that, you know, will give her that thrill. She's really yes, she is.
Well, she says she wants to do it again. What do you guys think about that?
She will not say that again. Every time somebody asks her that question, she looks at me because she knows better.
Doctor, you're expecting a full recovery?
That's like I said, we're still doing.
Hold on 1 second. We won't be able to hear.
Sorry.
Mike, move.
Yeah.
Scratch your table.
We're still doing our evaluations, not just physically, but our cognitive evaluations and everything. But like I said, from what I've seen so far, initially she's pretty good. She's able to talk to us, tell us what she needs, tell us where she's at. Her memory from even just before the accident is pretty good. So all of that tells me that it's not as severe as we may have thought. And so if she's continued to make this type of progress that we're seeing now, and she's young, and she's motivated, and she has great support, then I think she could potentially have a full recovery.
Doctor, how often do you see injuries like hers?
We see a lot of traumatic injuries here. So, I'm not saying we get this scenario, but we see a lot of different types of scenarios, and we see a lot of people with many different degrees of brain injury who may come in very severe and actually can recover quite well. Spinal cord injuries or strokes the same way. So, I mean, this is what we see this on a daily basis. John Skinner said that because we're right across the street from a level 1 trauma, we get this all the time, every day.
So when her dad's talking about her having superpowers, and that's a dad talk, as a doctor.
I still think it's incredible. The injuries she's had and the way she's recovered, I still think it's incredible. I mean, it's not that I've never seen these incredible or kind of miraculous cases in the past, and I don't think this makes it any less, incredible or amazing. And I think in her case, it's pretty incredible that she came out of this, and she came out with injuries that she could heal from and recover from.
Sort of give us a list of some of her main challenges now when it comes to rehab.
So some of the main challenges for her initially is her pain management and being able to manage her pain, where she's being able to tolerate activity without also over sedating or over medicating her. But she's actually done surprisingly well with that, and I think for her it's going to be mainly giving herself actually some time to recover, because she's a young girl. She wants to get out there again with her friends and be active, and I think for her the main challenge is going to be stepping back a little and give her some time to heal and recover, and kind of being able to understand what that means for her.
What about physically?
Physically, it's going to be, like I said, the pain. She has some fractures, and that needs time to heal. So she has a lot of weight-bearing restrictions, and there's some other areas where she's badly bruised and stuff. So it makes her being able to position in certain ways to do things difficult. So that's been probably her biggest challenge. And then, like I said, she's kind of been in an environment where she's, been really, everything, the care is right there for her, and she's been limited of what she has to do. It's just now in rehab where she's going to be forced to be getting up more and being kind of pushed to do what the most she can do. And also probably being a little more challenged as far as even cognitively and stuff, that's what we have to kind of wait and see and evaluate more.
So what are the injuries? She's got fractures here, there, what?
So, is that okay? I tell
Oh, yes.
So her injuries, she has some rib fractures, which can be painful if you've ever had a rib fracture. That can be pretty painful. And she has a hip fracture of her hip socket. She has some pelvic fractures, which are probably the most painful for her right now. And we're still working kind of on even her being able to go to the bathroom and stuff to where she's able to do it without it being like this major thing she has to do.
Any concussions?
She had some bleeding in the brain. So she did have bleeding in her brain, and that's kind of what we're waiting. Like I said, she's very, just if you talk to her, it's very normal, and that could be it. But I think we still have to do that kind of more in-depth testing to see if there's any more type of higher level issues.
In her spine.
And she had spine fractures, yes. But thankfully, right now, like her strength and her movement of her extremities and her sensation appears pretty intact. So I think her spinal cord itself has been pretty intact. So that's been, thankfully, that's been the case.
How long do you expect her to be here?
So like I said, she's only been here a couple days, and we're just really seeing her get up and move today, so it's kind of hard to say. But if I had to estimate right now, I would say a few weeks. But I think in the next day or two, we'll be able to get a better sense of that.
How isn't someone dead after falling from however high? Like, people fall out of trees.
Yes.
You know,
I don't know. I'm amazed at this case that she's doing as great as I don't know that answer, especially with just her size and stature. So I don't know. And like I said, I don't really know a lot of details about what actually happened. But even not knowing, I don't know how to answer that.
Did she face surgery down the road at all?
That's hard to say. I don't see, like, most of her fractures and stuff. They're dealing with non-surgically because they were non-displaced, so they weren't very. They were fractures, but the bones for the most part were in the right place. So I think they're wanting them to allow them to heal on their own by just kind of restricting the movement or bracing. So she'll need really follow-up to make sure those are healing right, to say that she doesn't need surgery. But right now everything is looking good to where hopefully she won't need any surgeries.
Oral surgery.
Yeah, maybe she has some dental fractures. So maybe that would be the only thing she'd have to get.
Mom, can we get your reaction? They had a pep rally last week. They have T-shirts and everything for Makenzie. Can you, what's your reaction to that? And Mackenzie's reaction? No, they should be fine. They should be fine.
She's very excited about everything her school's doing, and of course I am too. The T-shirts and everything is great. I believe they even delivered some of those T-shirts here for her and everybody to wear. So, I mean, it's amazing the things the school is doing for her. The pep rally, as soon as she got pictures sent to her, you know, it puts a smile on her face. She's real happy that everybody really loves and supports her and sending all of their prayers. Great.
She seemed to be busy over the weekend. A lot of pictures of.
And Kid on 106.1 did a fantastic job also of selling T-shirts.
Yes, she was very busy all
I want to
weekend.
give them thanks also.
Yes. She had a lot of people come to see her this weekend, so the pictures she likes to post and tweet and everything else, so she's doing great.
What will happen with school?
I went by there and talked to her school today on my way back, and we put a hold on everything right now as far as what to do, because we need to know how long she's going to be here first. But I mean, she's very eager to get her work started. I mean, school is very important to her. It's her first priority.
She's a junior, right?
Sophomore.
Sophomore.
Yeah.
Anything else?
You guys?
Thank you all very
Thank
much.
you.
Thank you.
Thank you.
Thanks for the patience with the microphone.